and campus is in the chat, that'd be great. Jason, Candy, if you guys could turn your cameras on, please. Thanks, Candy. Jason, could you turn your camera on, please? Okay, so a couple things. Are we in week 5? We're in week 5. Wow. Next week is halfway. Wow. So I've done some exam reviews, but not as many as I thought would be requested. So I will just repeat what I've said for the last couple of weeks, or this week, or last week and this week. If you score below an 80 or definitely 78, I would encourage you. I gave a whole bunch of times this week, I believe. Only about half got signed up for. So exam 2's coming up. So what I usually do at this point is, if you want to review exam 1 and 2 together, if we need to in a couple of weeks, but this is cumulative. So the information exam 1 won't necessarily be on exam 2, but everything combined at the end is on the HESI. You guys working on your HESI study guides? Please pull it out every couple of weeks and keep it up. Otherwise, it's going to be a time-consuming project here in a couple of weeks. This is the week that the faculty started at-risk meetings. I don't know if you know what those are, but those are campus meetings with your campus. And they're every other week. So we do a group of campuses this week, and then we do another group next week. And so as faculty, we are required to fill out what's called at-risk reports and send them to your deans, just to know where you're at. And those are done for students that are at risk. At risk can be a score below 78. At risk can be attendance issues. At risk can be homework issues, can be if there's any concerns. Okay, so some of you may have already heard from your deans. I don't know, but I just don't want you to be surprised when you do and they ask you, hey, did you turn in this? Or hey, could you attend class? Or hey, are you going for exam review? I see what your exam 1 score was. Okay, so don't be surprised, but we are required to do that. What else? What questions do you guys have for this week? Nothing so far? Okay. Let me share my, well, actually.
Professor, I have a question.
Yeah, I'm listening to you. I just have to go find something.
Oh, you're fine. Is there a rubrics for the group project?
Yes. It's not in the, yes, there is. I will get that out to you guys. There is. It's not populated in your modules. So yes, I'll send it to you. Thank you for the reminder.
Thank you.
Yep. And let's see, group rubric. You guys start working in your groups? At least start to make contact with each other?
Yes.
Okay, good. Okay, so let's go through the modules. I should have study guide 2 ready for exam 2, hopefully this weekend. It's being worked on. Okay, and so for this class, exam 2 will be covering weeks 4, 5, and 6. Okay, so I'm working on that study guide. Was the study guide helpful for your exam 1?
Yes.
Okay.
It was.
Okay, good. I know that past terms have not had study guides. I've been teaching the RN program for almost 2 years. We use study guides and extremely helpful. So I think I would like to offer you the same kind of tool. Okay. Now for last week, remember that there wasn't any reading, or excuse me, I'm sorry, there was a combination of reading. Okay, so that was your reading from last week in your chapters, and it breaks down if it's a whole chapter, if it's specific pages within a chapter. Okay, and then don't forget to review the module sheets. Okay, the module sheets are on pregnant adolescents, LGBTQIA in population, and mental illness. Okay, so these are found in your books. Everybody can see my screen, right? And this is how I'm building my study guide as well. Okay, from the readings in the module. Okay, and then reviewing these sheets. Okay. This week, anybody know what we're covering this week?
Hospice and palliative care.
Mm-hmm. Okay, so I've sent you the week 5 notes. And this is what we're going to be covering this week as far as chapters. So I'm going to pull up the books. I have the books pulled up, and I went in and read ahead and did some highlighting before this week. We also have a quiz this week, so don't do your quiz until after lecture. I know it's a Friday night class, so excuse me. There's not a lot of turnaround time. I'm working, if for some reason, since I can't let you redo the quiz if you've already done it, the Canvas won't let me. I'm gonna ask for that option for next term. If for some reason you want to redo the quiz, just let me know and just send me a Word document with your new answers if you've done it ahead of time and you want to get a better grade after listening to lecture. Make sense? Okay. Okay, so let's get into our lecture. A couple things. I'm going to pull up. Everybody got their week 5 notes. With each of the sections, I copy and pasted what the readings were. Okay, so let me show you what I did. So we've got our notes. And then I've also gone in. So for example, the first section is fundamentals of death and dying. Okay, you're supposed to read chapter 15, pages 206 to 218. Okay, so what I did is I went into the book and went to pages 206 and highlighted what's in our notes. So what I'm trying to show you is how I'm trying to connect all the dots. So I've taken the notes and I've gone into the book to show you where these areas are. Okay. What do you guys know about, what do you guys think hospice nursing is about? What's hospice and palliative care?
It's a lot of like pain control and comfort care.
Yeah, comfort care, making it for the end of stage life, comfort care.
Okay, so this is where you'll find your notes. Your notes are a summary of what's you're being asked to read in the book. Okay, box 15, this right here on page 206. Nothing you need to memorize, but I'd like for you to have a look at it. Okay, what are the rights of a dying patient? Okay, be treated as a human being, a person till death. Entitled to caring human contact. Have your pain somewhat under control to the best of your ability, and so on. But these are the rights of the dying patient. Okay, hospice philosophy is based on the acceptance of death as a natural part of life. It emphasizes the quality of the remaining life. Okay. I would like for you, this is a good exercise, to go through this nursing care plan. We're not going to go through it in class because I want to cover the notes, but this is an excellent self-guided exercise for you guys. Okay, it gives you a scenario, gives you a problem statement, and gives you some supporting, pardon me, assessment data. Okay. And the reason why I point this out is it goes through the nursing process. Okay, remember what we talked about is we need to be able to take the ADPI, your nursing process, and apply it to each topics we're covering. All right, so this concept is the dying patient, hospice and palliative care. So this is an excellent health plan, care plan that's been developed that pulls in all your areas of the nursing process. Interventions, rationales, and evaluation. Okay, so I would encourage you to do that. Okay, and then it has a couple of questions for you if you want to answer them, of applying your clinical judgment. Okay, so I really would encourage you guys to do that exercise. Very, very helpful. Box 15.1 is also a good box to review. Okay, we all remember Kubler-Ross and the stages of coping with death. Denial, anger, bargaining, depression, and acceptance. Please have an idea of what those stages are. I don't believe that's covered in your notes, but I've highlighted it, and so we need to know this. Okay, the areas that I highlight in the book are supporting information, supporting knowledge that will help you understand the concept we're discussing, which is hospice and palliative care. Okay. So I haven't introduced this yet, but I am going to introduce it. It's called QSIN, and this is in every chapter of the book. Okay, there's three sections of every chapter I really would like for you to review. Okay. QSIN, not so much for exams, but more of an understanding. QSIN is about competencies. Okay, we'll talk about that in a second. But the other two areas I want you to review in each chapter are your Healthy People 2030 goals and your levels of prevention. Because each chapter, excuse me, has levels of prevention identified with primary, secondary, and tertiary based on the topic we're covering. So in this particular chapter, it's going to be about end-of-life care. Okay, so two important boxes to review in every chapter, because there are questions on the exam with regards to Healthy People 2030 and levels of prevention. QSIN, I just want to introduce, is quality safety education. Okay, so it's actually competencies. Okay, we all know what competencies are, right? We need to be competent in the care we provide. So there's 6 or 7 different competencies, and each chapter picks a certain competency, and it applies that competency to what the topic is. So for example, the competency that's being addressed in this chapter is patient-centered care. Okay? And it's about the hope and dying process. Okay, so it talks about the competency of patient-centered care, right? So I'd like for you to have a look at that. You'll get a better understanding of what the competency, the expectation of the competency that's patient-centered care, how that's applied to palliative care, to the topic we're in. Does that make sense? And then this part is really important, okay? This walks you through, the section is called the application, and I'm still in the pages that you were asked to read. Okay, so I think it's 206 through 214. So this is, how do we apply the nursing process, the clinical judgment model, to the palliative and hospice care? And it goes through each of each of the nursing process. It goes through the ADPI. Okay, you don't need to memorize everything in all of these sections. I'm highlighting for you what's important to note so that you can understand the concept of death and dying. Okay, so it goes through the assessment, goes through the data analysis, the planning. Again, Houston comes up with patient-centered care. And anything that's in the middle of these assessment, data analysis, planning, implementation, and evaluation comes down here. Okay, so look at the whole section about intervention, or excuse me, implementation. Look at all the areas that are addressed in implementation. How do you do end-stage symptom management? Again, you don't have to memorize this at all. I just want you to get in the habit of being able to apply your nursing process to the topic we're covering. Okay, and that will take you all the way up through page 214. Okay, at the very end, there's 3 different legal and aspects of life and death issues. Okay, I'd like you to know what those 3 are. And maybe a 1-sentence understanding or definition of what they are. Advanced directives. What's an advanced directive? It's a legal document that outlines the patient's wishes for healthcare when they are unable to communicate their choice. Okay, that's an advanced directive. Okay, we're always asked for that in the hospital. Second is euthanasia. What's the definition of euthanasia? Act of ending another person's life and suffering, with or without their consent. Okay, and we're in legal and ethical aspects. So euthanasia, advanced directives. Then the other 2 are adequate pain control. These are legal and ethical issues that you're gonna, if you're working in hospice or palliative care. Okay, and it says that adequate pain control continues to be one of the most problematic issues in end-of-life issues, end-of-life care. Okay, and then the 4th legal and potentially legal and ethical issue is organ and tissue donation. So I just need you to know that there are 4 issues that legal and ethical may come up in end-of-life care. Okay, so let's go to our notes for this section. Okay, we've covered a lot of this already. Okay, hospice trying to alleviate suffering as much as possible. Obviously, we know we can't cure anything, right? Our goal is to improve the remaining quality of life. Okay, hospice. What's the definition of hospice? Palliative care of the terminally ill patient and their families at home or in long-term care facilities, or in clinics or in hospitals. Hospice is specifically for end of life. Excuse me. Okay. What kinds of support can we provide the client? Physical support, social support, spiritual support. I'm a highlighter, so just bear with me. Just trying to pull out the important parts here. Kind of go along with what's in your book. Okay. We need to know the definition of what hospice is. Okay. What are the stages of grief? There's the box in the book. So you need to be able to identify, if you're given a scenario on your exam about, here's the scenario, what stage of grief would this be? You need to be able to answer that. Okay, the other important, another important point to remember is therapeutic communication. Okay, Well, give me some examples of therapeutic communication. What are some examples? Do you give them your opinion? Do you tell them what to do? Hello?
No, you can actually like open-ended questions.
Exactly. Let
And
them express their feelings or hopes. Let them be involved if they're competent in the decision-making process. Are you aware of your own feelings about death and dying? What about family members that I mean, one of the goals of a hospice nurse in palliative care is to have the whole family involved. Okay, yes, you have a client, but your client is also the family. Right? What if there are family members that are uninvolved or distant or argumentative or not, whatever? How do you deal with that? How do you open the lines of communication up with a family member who may be really struggling? How do you get them to talk about it? How do you try and alleviate some of their fears? And how do we know what it's even caused from? Maybe a traumatic event in the past or something that triggered them about something that may have happened in the past that's putting them more at risk for dealing with the current situation. Okay, like you said, open-ended questions. What can I do to help you? What have you learned about the disease? Tell me how you're feeling. What are your concerns? Anything I'd like to talk about? Therapeutic communication is really important. Hey, maybe ask about spiritual or religious affiliations. And one of the most important things about therapeutic communication is being able to listen. That's really important. They don't need your opinion. They don't need your judgment. They need you to listen, and you need to listen carefully for clues. Clues of things they say like, why am I being punished? Why is this happening to me? It's not fair. I have so many regrets. How do you deal with those kinds of statements? So therapeutic communication is very important. Okay. Secondly is pain control. We touched upon that briefly in the book. Okay. Pain control is possible and it's expected in end-of-life care. We're not worried about addiction at this point. Okay, anything can be used. Opioids, non-opioids, non-pharmacological pain management. Okay. What if the patient is nonverbal? How would you become aware of nonverbal signs of pain? How do you teach families to be aware of nonverbal signs of pain? How do you educate families to stay on top of the pain? What do they notify the doctor for? Okay. And then what kinds of non-pharmacological pain management might you suggest? And here's some examples: guided imagery, relaxation, breathing exercises. Okay. Oxygen and suctioning are used with respiratory distress. Right? We're monitoring for constipation due to pain medications and immobility. Right? How are they fed? What are we teaching the family? Anti-nausea medication, maybe small meals. Keeping the mouth moist with fluids, ice chips, lubrication. These are all things that will come up that have to be that there has to be a plan for. Okay, skin integrity, another issue. Family education regarding the patient's mental status as they continue to decline. Okay, and what we know as death becomes more imminent, the client spends more time sleeping, their appetite starts fading away. Oral intake decreases and urine output decreases, and then maybe some incontinence. Okay, so this paragraph is, as death becomes imminent, what might you see? Hospice nurses are my heroes. I've had to work with them a couple of times with some different situations within my own family, and they are my heroes. It can be very draining, very hard, right? You need to be able to take care of yourself as well. Understand your own beliefs, your own values, your own attitudes regarding death and dying. And then how do you take care of yourself? How do you keep yourself healthy to just keep going and work with patient after patient? Okay. Questions? So your reading is in your fundamentals book. I just went through it with you, 206 to 218. Okay. Our next topic to discuss is faith community nurse. When you think of a faith community nurse, what do you guys think? What do you guys think? What's a faith community nurse?
I think of a nun. You
A
know,
nun,
like
a nun who has to be a nurse, but okay.
yeah, yeah.
Okay, all right. What else? What else do you guys think when you think faith community nurses?
Anything involving like spirituality, I cannot, that's not a word, like spiritual beliefs and stuff like that.
Adding the spiritual component to care, right? So I'd like to go to the book and highlight the areas that bear with me. I'm going to go to chapter 14. And any of you that have the book, you all have the books, but if you would like to follow along, I have a lot of students that follow along and highlight what I've highlighted. It's up to you. Just write down the page. You're technically responsible for the whole chapter. It says chapter 14, but I've highlighted areas that kind of match your notes. Okay. And again, in this chapter, since you're responsible for the whole chapter, I've highlighted the objectives. Okay. What I like, I think I've already said this, but each time you have a chapter, read the objective. It says, upon completing this chapter, you should be able to do. Okay. So in this chapter, you should be able to, that's how I build my lectures, because the objectives are the most important thing. This is what we want you to take out of the chapter. Okay. So at the end of reviewing this chapter, I mean, I'll be going over some of it, but you're going to have to do your own legwork as well, but you should be able to articulate these objectives, because those are the objectives that go onto your notes, and the information that supports the objectives is things that go on your exam. So everything's kind of connected, right? Your readings in the book, your notes are connected to your readings in the book. And then our lectures and the notes and the book assignments and whatever individual sheets there are to read in your module. This week there are not. It's all from the book, but last week it was nothing from the book and all the individual 4 sheets. Does everybody know what I'm talking about? Yes, no. It's important that you understand what I'm talking about.
Yes.
That's one yes. Is everybody following me?
Yeah.
Okay, all right.
Yes,
So-
ma'am.
Great, great, thank you. So in this chapter, I've highlighted the 11 objectives because you're responsible for the chapter. However, I have gone through the chapter and tried to pull out supporting evidence, supporting documentation, information that supports these objectives. Okay. So let's go through and see what I pulled out. And again, just because I highlighted certain areas doesn't mean I've covered everything. Okay. Here are the concepts covered in this chapter. Okay. And remember, the name of our chapter is Cultural and Spiritual Aspects of Patient Care. So there's two parts of it. Okay. Cultural care and spiritual aspects. Okay. Two completely separate but related topics. We'll talk about that. Okay. So here's the concepts covered in this chapter that have to do with cultural and spiritual. Addiction, anxiety, communication, culture, evidence, family dynamics, professionalism, and safety. Okay, so let's see what competency we're covering. We're covering patient-centered care again. Okay, so our competency that it is presented throughout the entire chapter is patient-centered care. And for this chapter, since it's about culture and spirituality, they talk about transcultural nursing. Okay, transcultural nursing has been going on forever. Okay, what does it mean? It means that we as nurses are able to provide culturally competent care to our clients. And in this diverse world, as we see it now, and I'm sure that you see in your workplaces, are you ladies and gentlemen working with lots of different cultures in your life right now? Whether it's the PTA at school or your clinicals or your families? Does differences in culture play a big part of your world?
Yes,
In what way?
I work with a lot of different cultures and
Mhm.
as well as the children that I work with, because I work at a home for disabled children. So
Okay.
it's a lot of different cultures and different people you have to get to understand to know why they do things the way they do.
Or what their beliefs are and what their values are.
Yeah.
It's called cultural competence. And I'm a big believer, I really hammer this home, is cultural competence. As nurses, we have to be culturally competent. We don't need to have to memorize every culture and every belief and value and do cultures, what are their healthcare beliefs? What foods do they eat? How do they communicate? We don't have to memorize every culture, but we certainly, when we're caring for people of different cultures, we need to be culturally sensitive. If that means having them educate us, it's okay to ask those questions. What are your attitudes? What are your beliefs? How can I best take care of you in a culturally sensitive way? Okay. Do we know the difference between spirituality and religiosity or religion? I just covered this with my last group. Okay, there's a difference between religiosity, we call it, and spirituality. Okay, spirituality is the big picture. Okay, it's your feelings about your relationship to the wholeness of physical and non-physical world. Do you believe in God? Do you not believe in God? What's your overall picture? What's your spiritual beliefs? But religion, on the other hand, we call religiosity. it's a very formalized system of a belief and worship. So wherever you practice your religion, church, mosque, wherever, doesn't matter. You are practicing your own religion within a congregation that practices the same religion. Does that make sense? So religion is very focused on one religion, where spirituality is what are your beliefs? What's your attitudes about the bigger picture? Again, we don't need to know everything about Christianity, Islam, Judaism, but we need to know what are some of the major religions in the United States and Canada. One of them is Christianity. One of them is Islam. And you can read through if you'd like to get be more educated on the different types of religion. And then the third is Judaism. Okay. Isn't that a beautiful picture? And then another, fourth one, Hinduism, Buddhism, and Taoism. Okay, so there's 4 common religions across United States and Canada. It doesn't encompass everything, but these are the 4 most common. Okay, and here, box 14.2 talks about the Muslim beliefs in healthcare. 14.3 talks about the Jewish beliefs in healthcare. And up here here's Protestant beliefs affecting healthcare. And then Christian beliefs. Again, nothing to memorize, just understanding that there are different cultures that practice very differently. And that we may be taking care of every single different culture. So best to have an understanding. If you don't, we ask. And then this is a great table, 14.2, religious dietary practices. It goes through all the different religions and different kinds of foods. Fascinating. Do we have to memorize that? Absolutely not. But if we're taking care of a patient in the hospital and we're helping them fill out their menu, we may be asking them, what do you do? What do you don't do? Then here on page 193, I really want you to read this section because I really am into developing cultural competence. Okay, cultural competence means being culturally aware, which means understanding the different health expectations across cultures that influence the care they're expecting to get, or how they treat death, or how they treat disease. And then cultural sensitivity. We have to be culturally sensitive. Are we able to engage and communicate with individuals from another culture? Right? Are we demonstrating a respect for their cultural norms and beliefs? And then here's the important, it's all important, but cultural competence here involves knowing yourself, examining your own values, attitudes, beliefs, and prejudices. As nurses, we need to keep an open mind to try and see the world from different cultural perspectives. Okay. And what are some cultural aspects to consider? Again, nothing's highlighted, nothing needs to be memorized, but just really interesting reading. Okay. What are some barriers? Okay. What are some barriers to cultural competence? What do you guys think? What would some barriers be?
Language.
Yes. What would some barriers be to our own? What about with regards to our own beliefs? Okay, what about stereotyping? Could that potentially be a barrier if we're stereotyping?
Yeah.
Yes.
Absolutely. What about prejudice?
Yes.
Right? That could be a big, big, big problem. What about racism? Ethnocentrism, right? Cultural conflict. I'm just going through some of these barriers right here. They're right here. Just have an idea of what the barriers are. Stereotyping, prejudice. Okay. You may get asked about this, and what are some barriers to cultural competence? Select all that apply. I don't know. Be able to pick these out. Okay, cultural imposition. Right? We're imposing our beliefs on somebody else. That's considered a barrier. Right? Cultural conflict. Now, what if there's a misunderstanding? Right? There's a misunderstanding about expectations and you don't respond the right way? Easy fix. I'm sorry. I don't understand. Help me understand. You're not expected to know everything. And then cultural shock. Okay. Cultural shock is basically when you're unable to even conceptualize the beliefs and values of a certain culture. All right. Discomfort with caring for somebody in a certain culture. Okay. Here's some of the aspects of the culture that are the most common areas that we should focus on. Okay. And you just need to know what they are. It goes through each one down here. You don't necessarily have to read through all of them, but what are some common areas of cultural differences that are going to be different, that we know they're going to be different in cultures? Communication for sure. View of time. Do they live in the present? Like, for example, Native Americans live in the past. So if you are helping them trying to schedule future visits, they'll need help. They're in the past. They do not think to the future. What are their beliefs in different cultures about personal space? They like to be huggy or up close, or no, arm's length. Family and social organization and structure. A lot of cultures are family only. A lot of other cultures are everybody. Okay, what are their nutritional practices? Issues related to death and dying and healthcare beliefs. So those are the common areas of things we need to think about when we're thinking about different cultures. And then it goes through all of them right here. Okay. Here's our CUSIN consideration. Again, they're using the patient-centered care competency. And the example they give is food and the patient's family. All right. So here's what here's for us to be culturally competent, we'd need to know in some cultures, family members provide food for their patient. Right? Allowing family to bring in their own food may help them meet their needs, nutritional needs. Okay. That's okay. Or they approach death and dying healthcare beliefs. Okay, so what I would like you to know is the areas in which the most common areas that are going to be different. And that's this. If you want to view any of these areas, just go right here below and pull up that section. Okay, and this is another section I want you to review. This is towards the end of the chapter. We saw this in chapter 14. It's the nursing process and clinical judgment model with regards to culturally sensitive nursing. And so again, this outlines for you how to apply the nursing process with regards to culturally competent nursing. Make sense? Here's some cultural considerations. This is just going through your nursing process. I think we're still in the assessment phase. No, we're in the implementation phase. So during the implementation phase, they share what are some cultural considerations? What are some culturally sensitive nursing interventions? Do we need an interpreter? Do we need flashcards? Some cultures want the whole extended family involved in everything. Okay, so just some considerations. And then we're all the way down to evaluation here. So again, wonderfully laid out for you the nursing process and clinical judgment. And then I like this because we had to cover the whole chapter. I didn't do this for chapter 14 because we only had to cover certain pages. But since the expectation is the whole chapter, even though I've highlighted the sections I feel like support the objectives. Look at these two sections. This is awesome. Getting ready for next gen. It summarizes this whole chapter right here. Page 200. Okay. Key points to take away from the chapter. And these key points support the objectives. Okay. And then look at the other resource you have here. You have review questions for next gen. Okay. And then another activity, if you'd like to do, are some clinical judgment activities. You have a couple of scenarios. And I will go on to Elsevier because I thought they provided your answers, but it looks like they do not. So I'll get you the answers and get them back to you. How's that?
They do. And if that's like one of our main books, it's the real severe. They have a
Oh,
download.
okay. So I don't have to go get those for you. You guys can go get them. If you choose to do the exercise.
Yeah, if that's the end of the chapter to review things, yeah, we can
Okay.
access the answers online.
Okay, awesome. So any questions about that? Let's go back to our notes and see how much we covered. So I'm trying to keep everything connected. So what I'm highlighting in the book and what we're going through should be the same as in your notes. It's not two separate pieces of information. Does that make sense? Should all tie together. I really like to do focused, targeted teaching. There's a method to my madness, promise. So let's go to our notes. We talked about the faith community nurse. Yeah, religious. So we're just in summary, religious spiritual beliefs have a significant impact on our ability to cope with acute and chronic illness. I'd say the same for culturally sensitive care. Our religious beliefs, our spiritual beliefs, right? They do have an impact as well on how we care for patients, clients, right? And then here's your important to know the difference between religion and spirituality. Okay. And here's a summary of that. right? Religions are specific to a certain religion, spirituality is your attitudes towards a higher power. Okay. Here's our therapeutic communication. We should approach each client with an open mind and ask open-ended questions and be flexible. Okay, the difference with faith-based nursing, okay, is the spiritual aspect is added into the care. Okay, if the spiritual aspect is vital to the client's care, then it should be incorporated into their care. Maybe they want to see a chaplain. Maybe they want to talk to a priest. Maybe they want to have them pray with them. Here's some examples of primary, secondary, tertiary with regards to faith community nursing. Primary, education, providing education, preventing things before they happen. Secondary, screening, teaching signs and symptoms of whatever. Blood pressure screening. What are the signs and symptoms of high or low blood pressure? What about with the adolescents or pregnancy? People that are pregnant within your congregation. Okay, who's at risk? How do we screen for who's at risk? And then tertiary. They already have an issue. They already have a condition, right? We're supporting patients with diabetes, asthma, obesity. So we're working towards management, reducing side effects, prolonging not life, but helping them manage their symptoms so that they can live longer. Okay? Any questions about that? So we covered cultural sensitivity and spirituality or faith-based nursing go hand in hand. Okay. Then the last section is ethics. Okay. And that's chapter 3, but you only have a couple of pages in chapter 3. So let's talk about ethics. Why is ethics one of the foundations of nursing? Legal and ethical aspects of nursing. What is ethics? Why is it important? What's an example of
Moral,
ethics? What about
like not having like ageism, not discriminating because of race or their social economic backgrounds, just
ethics in nursing? Okay, do you have to cover?
wait, did you hear me say anything at all?
I did, and that's exactly right. It's
Oh.
moral. Yes.
I thought I was on mute.
No, I did. That's exactly right. Ethics is one of the foundational competencies, right? Everybody has a code of ethics, right? I'm sure you have a code of ethics within your family. There's a code of ethics within your job. There's a code of ethics in whatever nursing you practice, whatever type of nursing you practice. Hospice nurse has a code of ethics. Home health nursing has a code of ethics. Okay. Ethics in nursing is foundational principle. Right? Ethics or ethical principles are rules of conduct. Okay? They've been agreed upon by a particular group. All right? And like you just said, these rules are morally right or proper. Okay? Nurses, physicians, lawyers, parents have developed codes of ethics that provide a set of what are they? They are a set right here, a set of guidelines outlining behavioral expectations of the profession. And they're all different. Ethics are different from laws. Okay, there's no, I'm not going to get into all of that, but ethics is linked to values. When you think of ethics, you think of values, right? So right here, ethics is closely linked to values, the worth or importance of an action or belief to an individual. Okay. And what's a dilemma? What would an ethical dilemma be? It's a problem or a conflict that arises when you have different values. Okay. Like I said, code of ethics. Okay. Everybody has a code of ethics. Okay. There's a main code of ethics with the American Nurses Association. Okay. And here's their 3 core. Okay. Respect for human dignity and the individual. Right? Their nursing care is not affected by race, religion, lifestyle, or culture. A commitment to education, maintaining your competence, right? Evidence-based practice. So you're always using the best evidence-based practice to care for your patients. And then confidential nature of your relationships with your clients. Okay. Most places, organizations have ethical committees now, right? Where they bring different cases in front of committees and it's a team of multidisciplinary approach, right? They may be developing policies, they address issues in their facility. Okay. And then we know that the nurse will likely face many ethical dilemmas across her career. Okay. A lot of it has to do with end of life decisions. Okay. And what are your values and beliefs? We just kind of talked about that. Okay. And then here's what we need to know. We need to know these ethical terms of nursing. I need you to know these definitions. You'll be asked about this on the next exam. Okay. These are ethical principles, ethical terms. What is beneficence? Okay, beneficence means to do good, right? You're taking positive actions to help others. Beneficence. Non-malfeasance. You're practicing to avoid causing harm to anybody, and so on. Veracity, being honest. Fidelity, keeping promises. Autonomy. What does it mean when it says respecting one's self-determination? What does that mean? What does self-determination mean?
I would think it means like not putting them down with the goals that they're making for themselves.
Okay, that's part of it. But the other part is competency. That's what autonomy means. If your client is competent, then they should be autonomous in making decisions about their care. Right? We have an exam question in one of the RN exams, and it talks about autonomy. That the question is about a elderly couple that moves in with their adult children. The 2 of them are competent. They've been doing their bills. They've been paying their bills. They've been managing their finances forever. And they are both autonomous in doing it. However, we ask about a red flag. Okay. However, their son decides that he's going to manage all the finances. Okay, they're out of the loop now. Would that be concerning to you if they are autonomous or have been autonomous? Do you understand what I'm saying? Why would you remove them from doing a task that they're competent at doing? The right answer is this would be a red flag, right? Because maybe there's signs of financial abuse. Okay, so that's ethics, that's autonomy. It's respecting someone's self-determination to be able to determine what they want. Go ahead.
Is Jason in the move?
What?
Jason in the move?
Pardon me? The next is code of ethics. Okay, and I've highlighted for you 2 boxes that have to do with LPNs and vocational nurses. Okay. So I would like for you to read those. Okay, hopefully you've already seen them, but it's important for you to know. Code of ethics. Okay, so that you only have 3 pages in this book, and I've highlighted what I believe are the most important parts about it. But this is a must. Wait, where am I going? This is a must. Ethical terms. Okay. Okay, let's go to our notes and see what we're going to cover here, or if we've already covered it. Okay, so that was in chapter 3. Everything's in your fundamentals book this week. Okay. Okay, so we're talking about ethics, legal and ethical aspects of patient care. So moral distress, what is that? Okay, so moral distress is when we are unable to act in accordance with what one believes is the right course of action. Moral distress, right? At some point or another, nurses experience moral distress. Okay, depending on what kind of nursing you work in and how stressful your job is, right? It can lead to stress, burnout, leaving the profession, right? It's really important to face that head on. Okay, discuss with your colleagues, discuss with your friends, your family. Okay. You can't ignore those feelings. They're going to come up all through your career. Okay. What are some examples of moral distress that you might be faced with? End of life decisions. Working where your patient loads are too high. You can't do it. You don't feel like you're giving safe care to everybody. Okay, these are moral distress examples. Look what happened with COVID. Restricting all the visitors, patients dying without families alongside them. Not enough ventilators, tough decisions. Who gets a ventilator? Right? EMTs being told not to bring patients to the hospital. They're unlikely going to survive, maybe in a disaster. You will be faced with these things. And nursing is a tough profession, but it's awesome. It's awesome. So an ethical dilemma is facing a decision with 2 morally justified courses of action. You see it one way, somebody else sees it the other way. Okay, so you have to use ethical decision making. Okay, how do you use ethical decision making? Okay, so what's the decision-making process in an ethical dilemma? Right? First, you have to identify what the issue is. Then you have to obtain the relevant facts, consider the approaches. So these are your ethical theories. Okay, so here's one. the theory of utilitarianism. Okay, what is it? It's also called principalism. Okay. You make a decision. You implement an action and get an outcome. Okay. So you need to know what the principle of or utilitarian is. You make a decision and then you evaluate the outcome. Okay, so here's what you need to understand. Ethical decision-making is complex. You need to understand ethical theories, ethical principles. Okay, ethical principles is what we just went over in the book. Okay, that was that list of beneficence, non-malfeasance. Okay, here's your ethical theories. Okay, so principalism, okay, uses the ethical principle such as respect for autonomy and beneficence. Okay, that's one. Second is autonomy. Being able to make your own decisions, deciding on your own actions without interference. Right, as long as it doesn't hurt someone else. So I think what I'm going to do here is just highlight the word, because it's going to turn out that I'm going to highlight the whole paragraph. So here's your ethical theories. You may be asked, given a scenario and said, which ethical theory does this apply to? Okay, so principalism, autonomy, beneficence, non-malfeasance. This is actually a summary of what's in the book. Okay, distributive justice is another. Okay, the ethical theory of distributive justice, fair distribution of benefits and burdens of society on everybody. Those with the greatest need and the least ability to provide for themselves get the most help. Non-malfeasance, it was in the book, do no harm. Beneficence, that was in the book, do no good, to do good. Do the most good you can within the limits that you face. Okay, so those are your theories. And that was that small list in the book, but the book I don't think it had principalism in there, and I don't think it had distributive justice. So you need to be able to add those to that list. Okay. Here we talk about utilitarianism. Okay. Again, for the third time, it focuses on the outcome. What is the greatest amount of good with the least amount of harm? Example, so locking people down during COVID in an attempt to slow the spread of the virus adheres to this principle, where the ends justify the means. Okay. Another theory is deontology, which is the opposite of utilitarianism. It focuses on the action itself versus the outcome, that you're choosing a certain action regardless of the end result. Okay, then we talk about what's virtue ethics. Those are decisions made on character virtues. Okay, trustworthiness, integrity, conscientiousness, compassion. So the kind of hard example is given. So would I decide to provide high quality nursing care, or the same quality if I was working in corrections to a murderer? Because you have integrity, and integrity requires that you provide the same standard of care to every patient, right? Do you have compassion, that knowing that He's a person, he or she are a person too. Okay. And yes, they have past action, past mistakes, but these are the ethical things that come up in nursing. Okay. Feminist ethics. Okay, what is that about? Feminist ethics, they advocate three things: economic, social, and political equity. Okay, for any marginalized, oppressed population, not just women. Okay, so here's a little synopsis of feminist ethics. Okay. Okay, so what were some of the issues? Nursing home life during COVID. What happened? Isolated, unable to see family, unable to visit with other nursing home residents. Didn't eat in the dining room. So that's autonomy versus beneficence. Okay. So again, we're just repeating the words we've already talked about, but just giving you different scenarios of where they apply. If you can no longer provide high quality nursing care due to, pardon me, moral distress or ethical dilemmas, right? You have to come up with some kind of alternative before you just stop caring for the client. Here's an example. Working in a home health and a client makes an unwanted sexual advances towards you. You must transfer the care of the client to another competent nurse or home health agency before he can stop going out there. Right? In the hospital, you're assigned a patient that you learn is a murderer. He came to the hospital from prison. And you've had a family member murdered in the past. You know you can't be objective and provide unbiased nursing care. You've got to get that care transferred to somebody else. Okay? Your first duty, this is really important, your first duty is to always provide standard of care nursing services to every patient and their family, no matter the circumstances. You have to provide a basic standard care of nursing, right? And then your duty to provide high quality nursing care should be guided by your ethical principles, right? You can't make your decisions based on fear or worry that you're going to get sued or, you know, based on a past bad experience you had, right? You can't be of the belief that some people don't deserve good. You can't. Murderers, addicts, sexual predators. We talked about this, the code of ethics for nurses. Okay, especially the one by the ANA. Ethical values and obligations of nurses and nursing practice. Ethics is really big. That's why we're spending a lot of time on it. Ethical issues are huge. Okay. Then advocacy, really big in nursing. We're advocates all the time, aren't we? For our patients, for our coworkers, and for our kids, if we have kids. Nurses are always advocates. Okay. We use the information we have to benefit the client. We're trying to act in the client's best interest, maintaining confidentiality and trying to act impartially. Advocacy is a big word in nursing, right? You want to help carry out the preferences and the goals of the client with diligence and competence, right? Does the client have all the information they need before signing an informed consent? Do they know all the options, the example given here? Do they know, can you help them find the cheapest medication? They don't have insurance. Can you help them, give them options or tell them where to go for insurance, to look for insurance? Helping them fill out a Medicaid application, Medicare application. That's what advocacy is all about. Making sure the client's wishes are carried out. Okay. So those are your notes for this week, and we reviewed the book. So can you see how it all comes together? That's how I build my notes. That's how I build my study guide. That's how we build questions on the exam. Is that helpful to go through it that way?
Yes,
know
it
it's-
was very-
Yes.
yes, it was very helpful. Thank you.
I know
Yes, it
it's late.
was.
I know it's late. I know it's Friday night. I get it. So let's, maybe if we're done, which I'm done, I'll answer questions, but maybe with your time, you should take 10 minutes and go do your quiz. And get it done. Then you have to think about it over the weekend. And then let's everybody pull up let's do this first. Let's pull up your attestation. Just so we can get it done. I'm tired of chasing people on Monday morning. Do your attestation. Just do it during class. That's why we're doing it. I mean, don't take that the wrong way, but there's an opportunity to do it now. Let's just get it done. Haven't got there, Tara, I haven't got there yet. I'm working on it. Okay. Thanks. I saw your email earlier. So pull up your attestation just today. What's today? The 12th. Tomorrow's my birthday. Getting old. Getting old, folks.
Happy early
Happy
birthday.
birthday.
Happy early birthday.
My birthday wish is for my baby grandson Patrick to get better. That's my birthday wish. I'm gonna be 61 years old tomorrow. Anyway, that's my birthday wish, to feel better and hold baby Patrick. So today's the 12th, so just 8/12 Marvel and hit submit. The only people that I assume don't do the attestation like now and hit submit is maybe they're not at their computer or not, they're at a place where they can't do it. But you're a Friday night class, you just get it done. Otherwise you have to think about it over the weekend. Thank you. I'm not really into birthdays. Last year was okay at 60, but I'm not a birthday person. Now my kids think that their birthdays are national holidays, so that comes from their dad. I don't care about birthdays. Okay, so everybody hit submit with their attestation. I'll stay on for questions, but I would encourage you to just go to your quiz and get it done. If you've already submitted your quiz and you don't think you did well on it, because I haven't looked, and you want to resubmit it, just send me an email with the other questions or the other answers, your second set of answers, and say, please replace those. I'm cool with that. Okay, which is why I encourage you not to do your quizzes until after, but it's hard for you guys. You're a Friday night class. It's hard for you guys. I get it. So I'm open to that too. If I could reset it for you, I would, but in this particular shell, I can't. Going forward, I will be able to, but not for this term. So that's why they give you a second opportunity. And same with your NCLEX. If you end up submitting an NCLEX in your 30s, I'm sending it back to you and saying, please redo it. Okay, because you didn't learn much. Okay, you got to. One thing I learned today, and I heard over and over and over again in this conference about next gen, the more practice that you guys can get, more case studies, NCLEX questions, next gen practice questions at the end of chapters, The more you can practice, the better you're going to do. I heard that over and over and over again today. And I know this is, you know, community, little old community class. I get it. But, you know, number one, you have to pass the class, right? To move on. And number two, I don't care what kind of nursing you go into, you will work with some kind of community nurse or some kind of community service, even if it's discharge planning. When you're discharge planning, who do you have to talk to? Somebody in the community, right? They're going home or they're going to another facility or so. Again, this class is really intended to expose you about how integrated community nursing is within your nursing profession. So, okay, that's my mantra for today. So listen, everybody have a good weekend. Reach out if you need anything. Tara, I will, in fact, I'm going to do that right now after I get off class, get it in there for you. And I'll stay on if anybody has any questions. I'm going to stop recording. Hey, listen, thanks guys for the birthday wishes. I shouldn't even say it was my birthday. What was I going to say? Try and do your quiz. Have a good weekend. And we'll see you next week. But reach out if you need anything. Okay? If anybody wants to review their exam that
Thank you.
kind of blew that off, just let's do it. Okay, I'm here for you guys. All right? We're all going to get over the finish line together. Teamwork. Okay? Bye, everybody.
Thank you. Have a good
Bye.
evening.
Bye-bye.
Thank you.
You're welcome. Oh, did everybody? Oh, too late. I think everybody did.